So let's introduce the night lens flyers. You'll see in the flyers you've got two different types. The blue one is geared for just general night lens information for all age groups of patients. You can see we've got the infographic on the left-hand side as to how it works. We've got the lifestyle benefits. A couple of case examples from a surgeon and a surfer. And then we've got the flyer, which is age for 5 to 18-year-olds. So this is really for developing myopes. And again, we've got the infographic. We've also got this graph in the middle. So let's have a look at this graph in a bit more detail. We can see what we're trying to do here is combine two bits of information. So the amount of myopia and what impact that has on the quality of the vision. So that's what the test chart is on the right-hand side, and that kind of correlates roughly with the myopia on the left-hand side. So we can see that once you get to in between a -1 and -2, you start to, without correction, you would start to not be able to meet driving standards. And then once you get up to -4, -5, you're going to be beyond the top line of the test chart. Of course, the term that generally the public use when they haven't got their glasses on, they say, "Oh, I'm blind without my glasses on." So this is where the sort of blindness term comes in. So this is recognised by the WHO as uncorrected refractive error, so it is quite an important statistic, but of course, with correction, you can see well. The next part of the information, which is the new part of information we want to convey to patients, is the risk with short sight. So of course, with every diopter of short sight going up, we now know that there's a 67% increase in the risk of myopic macular degeneration. So in elderly life, if you're a higher myope, then there's a risk, you've got increased risk for sight loss. Now that of course is a different kind of blindness than you have when you're young and you put your glasses on, you can see. This of course is the blindness when you put your glasses on and you can't see any better. So combining these two bits of information in the one graph gives us a really good introduction to talk to patients about this and explain to them the fact that if you're a -4, you can't see the test chart, the top letter on the test chart, but the night lenses are going to correct that. But if you've started to wear them when you're young enough, there's potential actually for them to reduce the total amount of short sight that you would have, meaning that you would be in a lower risk category for elderly sight loss and sight loss issues with age. And you can see in the back of the flyer, we've got 3 case examples. One from a wearer, one from a parent, and one from an optometrist. And then we've got a comparison chart in the back between the different lens options available. So that's the flyers that come with the night lens stand.